let's talk about this with a Conservative MP, Sir Geoffrey Clifton Brown, who joins us now. Good morning to you.
Good morning, Julia.
Good morning. What do you put this? Well, I say it's not complete change of heart from the Prime Minister, because we've had this really since the government decided to end step 4 of the last lockdown. Remember that in July last year, and then of course not having stricter measures brought in the autumn, and resisting those urges, and then before Christmas. So again and again in the last 6 months, the Prime Minister does appear to have stood firm against those repeated demands for more measures. But I have to say, I wasn't very confident that we'd get through a Christmas without too many restrictions, or indeed some version of lockdown in January. Are you now confident that we have seen our last lockdown here in the UK due to COVID?
Well, I think we're moving towards that situation. We're moving towards normalizing our lives and learning to live with this dreadful COVID virus. And I think that is a thoroughly good thing. We can't, I think, on the longer term, keep shutting sections of the economy down, taking away people's liberties, damaging children's education every time we get a new variant. So we've got to try and normalize the country. And I do praise the Prime Minister for doing that. I think he's withstood all the considerable pressures over Christmas, as you say. And I think that's allowed people to lead a relatively normal life during Christmas and the New Year. And let's hope we can now move on and the National Health Service can cope with the number of admissions that they're now having.
Yeah, I feel like I don't give enough credit when they do get those things right. I still don't think we should have Plan B restrictions at all. I think everything should be guidance. But I'm very unhappy about masks in classrooms. But it's a lot better than it could be. Bearing in mind, this time last year, children were sent home from school and weren't back in again until early March. So things could be an awful lot worse. But I don't think we should be grateful for having some freedoms rather than having all of them. In terms of where we are in terms of the practicalities now, though, there's talk about changing these testing rules so they can be relaxed to ease pressure on staff shortages, limiting, for instance, PCR tests to those who've got symptoms as opposed to anyone at all who tests positive, given that 40% of people are asymptomatic and are thought to be less able to pass the virus on to people. And given that it is now a virus which is akin to flu levels, and we don't normally test people for flu or make them stay, force them legally to stay at home if they come into contact with someone who's had flu. Do you think that is the right way to go, and that we need to just be a bit more sensible about the restrictions we put on people when they come into contact with COVID?
So in answer to your last question, Julia, I want to see the Prime Minister relax all of the existing restrictions as soon as it's reasonable to do so in terms of the NHS. In terms of the testing going forward, I haven't had a PCR test for weeks now. I've had lots of lateral flow tests. And I think this is a sensible, again, another sensible measure to try and normalize our lives. And if you test positive with a lateral flow test, then of course you need a PCR test. So I think this is sensible.
Well, actually, under this plan, it was in front of the Telegraph today, that's not the case. Well, why did you, if you haven't got any symptoms whatsoever, why do you need to have a PCR test?
No, I think if you're a frontline worker, though, it does make a lot of sense. And I think this is a good way of starting to reduce the pressure on the NHS and other frontline services so that they take these lateral flow tests. And if they prove positive with a PCR test, then clearly they shouldn't be working in the national.
Well, it was announced at the press conference that 100,000 key workers in key areas, they're going to be getting daily, definite access to daily lateral flow tests. That we told you to keep everything functioning. To a certain extent, though, it is the testing that is stopping things functioning. If you constantly test, we are testing in this country at a rate far in excess of any other country, even those with higher case rates. There's no evidence that this mass testing, was it 37 billion quid in total, it's costing, that this is actually having any effect in terms of crushing the number of cases, infections or deaths.
Well, I agree with that. I think it's only if you're in an important frontline job or where you're in very close working proximity. There are other jobs in this country where you are working in very close proximity with different people each day. I think it would be sensible to keep that sort of lateral flow testing. But the mass testing that we've got at the moment, I entirely agree with you. It is unnecessary unless you've got the symptoms.
Well, we've got 1.2 million people currently in isolation. I'm one of them. I do actually have symptoms, and hundreds of thousands more waiting on test results. We're going to see more of that. We may end up seeing, pressure, as the Prime Minister admitted yesterday, of the NHS, parts of it feeling, he says, temporarily overwhelmed. There's talk today that schools could open, and then many of them could end up closing temporarily because they simply don't have enough teachers to be on site. It's going to be a difficult few weeks, isn't it?
So firstly, I mean, this is really interesting. Before we move on to what you've just asked me, you've got a positive test. You look to me, with great respect, not too ill.
I'm going to be very honest with you, Sir Geoffrey. I'm actually really feeling quite unwell. I've just taken a lot of drugs and I've got about 3 inches of makeup on.
Oh dear. But
imagine how bad it would look without it.
Hopefully you're not that unwell that you need to go to hospital.
No, not even remotely. I'm the second time I've had COVID. Not even remotely. And the holiday was well worth it, frankly, having bought it abroad.
Well, let's hope you get better really soon. But on your more serious point, we've got to try and get back to normal, I think, and particularly with children in schools. I think we've got to look at that very carefully. I don't know how this mask wearing in schools is going to turn out, how much it's going to affect children's education. I suspect it's going to be quite difficult, particularly with younger children. So I think we need to try and, as soon as it is safe to do so, move away from all of that regime.
No, but this is a key phrase, though, because I know that you're very sensible in these matters. But when we use this phrase, as soon as it is safe or until it is necessary, even when I spoke to Nadeem Sahawi, the Education Secretary, about this on Monday, we never get a definite number. It never seems to be a question in these press conferences at Number 10 either, right? No. So what is the point when we say that's enough now? When do we just say we're getting on with it?
So if you look at the news this morning, the fact that some of these hospitals in Manchester are closing down to normal operations.
That happens a lot of winters, regardless of COVID.
It does. I accept that, but we don't want to see too much of that, because there will be people who are out there who've got serious illnesses other than Omicron, and we want to get the National Health into a position where they're able to treat those people. So we need to get people back to work in the health service and try and normalise it as much as possible. And I actually think once this Omicron has done the rounds of a quite significant percentage of the population, they're not going to get it again for a few months. That actually should begin to lead us back into normality.
That's certainly the hope. Now, before I let you go, I must ask you, as you are a knight of the realm yourself, Sir Geoffrey, what you make of this big row about Sir Tony Blair, the former Labour Prime Minister, being knighted in the New Year's honours. Massive big row about this. And so we're going to talk to Lord Charles Moore, the former editor of the Daily Telegraph, a little bit later in this hour about this. But more than 880,000 people have signed a petition to strip him of the knighthood. The argument being that he lied to take us into the 2003 Iraq War and doesn't deserve to have the highest honour of being a Knight of the Garter. What do you make of the row? Do you think he should have a knighthood or not?
Well, I'm a little bit perplexed as to why it's taken so long. So there must have been controversy about it before he was actually given a knighthood, and
maybe he didn't want one.
Well, I don't.
I mean, as a former prime minister, surely if he wanted a knighthood or a peerage, that would have been done like that.
Well, can I suggest actually being mischievous? The one person who probably didn't want it was Sherry Blair. She didn't want to become Lady Blair. But anyway, where we are. I think that on the whole, whatever you think of Tony Blair, and he made some pretty big blunders, taking us into war with Iraq and so on, I think probably a former Prime Minister of this country does deserve a knighthood. However controversial they are, it's an important job, and he was Prime Minister for a long time. A lot of what he did, I totally disagree with, but I think it's probably right that he should have a knighthood.
Do you think it's likely that even if there's now enough people who've signed this petition, there's going to be a debate in Parliament about it? Do you think there's any likelihood of him being stripped of this knighthood?
Well, I think clearly the Honours Secretariat, who make decisions on these things, will need to be cognizant of the number of people who are very unhappy about this. And there is this petition going to Her Majesty to ask for it to be reviewed. And I think that's exactly what they should do. On the other hand, honours are for services given to this country. I don't think they should necessarily be either given on a populist vote for them or taken away on a populist vote against them. That's what the Honours Secretariat are there for. But they should, I think, take into account the public opinion. But in this case, I think Blair, yes, a lot of very controversial things, but he was Prime Minister of this country for a long time.
Thank you very much, Dee, for joining us. Sir Geoffrey Clifton Brown, appreciate that.